Today we're going to review the best toothpaste for sensitive teeth. About even 15 years ago, there were only one or two particular toothpastes which were marketed for people who had sensitive teeth. However, now there's a whole array of different toothpastes for sensitive teeth. To go even further, even each brand has different types of toothpaste for different types of sensitivity. So a brand could have 2, 3, even 4 different type of toothpastes for sensitive teeth, each with a particular function. So I have chosen out of 12 different toothpastes for sensitive teeth, I have chosen 5 which I want to review in more detail, as I think these are the ones that will give you the most improvement. There are other things to consider also apart from whether they are effective or not, and this is how much they are, because undoubtedly when something is more specialized it does cost more, and if you're going to use it over a long period of time, these costs can significantly add up. So I'm also going to be looking at the costs. I'm going to be looking at the actual formulation itself, and also what is it actually like to use in terms of consistency, taste, and so on. So the 5 toothpastes that we are going to be looking at are as follows. Number 1, Sensodyne Repair and Protect. Number 2, we have Colgate Sensitive Pro Relief Toothpaste. So these are the 2 big guns, you could say, of the sensitive toothpaste world. And then we have a natural toothpaste. So this one is made by the green people, and this particular one is fennel and propolis toothpaste. All fairly recently, all of a sudden the natural toothpaste market has taken an upsurge in the amount of people who are using these products. So we will really look at what the reality is. The next contender is the Oral-B Pro Expert Professional Protection. So this is another one by the 3 big guns, i.e. Sensodyne, Oral-B and Colgate. Now this particular one claims to give protection against sensitive teeth, but also gives all-round protection, so for gum disease, bad breath, whitening function, and so on. So this is quite common as well, where there is a sensitive toothpaste and it combines another factor as well, such as tooth whitening. Right. Number 4 is the this is a Sainsbury's own brand toothpaste. It's called Oral Care Plus Sensitive Toothpaste. The big eye-catching part of this toothpaste is its price, but again I will look at to see what's actually in it and what is it actually like to use as well. Finally, Sensodyne have also brought out a toothpaste for those people whose sensitivity is due to acidic drinks and foods. This is called the Sensodyne Pro Enamel Care toothpaste. So this is even more specialized, and again we'll look at the claims of this particular toothpaste. So before we actually start reviewing the toothpastes themselves, we're going to give a general summary, overview and background as to what causes sensitive teeth and how is it generally treated by dentists, and what you can do as well to minimize it. Dentists generally tend not to use the word sensitive teeth, and they are quite particular in what terminology they use. This is because a tooth can be sensitive due to other reasons, for example decay, or perhaps sensitivity around a filling that's just been placed. However, the term sensitive teeth is used with a particular terminology as dentists. So if you go to your dentist for sensitive teeth, they may use the word dentine hypersensitivity. You may also use interchangeably, you may use the word hypersensitivity interchangeably with sensitivity. So you may call it dentine hypersensitivity or dentine sensitivity. Another term similar is dentinal hypersensitivity or dentinal sensitivity. Another term yet again is cervical hypersensitivity or cervical sensitivity. Cervical literally means the neckline of the tooth, so it's the part of the tooth around the gum line, and this is where sensitivity commonly occurs. You may also use the word root hypersensitivity or sensitivity, and less commonly segmental hypersensitivity or sensitivity. So for the purposes of this talk, I will stick to the term dentine hypersensitivity, and in dentistry it's got a particular definition as well, and the British Dental Journal define dentine hypersensitivity as pain derived from exposed dentine in response to chemical, thermal, tactile or osmotic stimuli which cannot be explained as arising from any other dental defect or disease. So this definition is what I call a ruling out other conditions definition. So sensitivity is dentine hypersensitivity is what you are left with when you ruled everything, all the other common situations out, for example a decayed tooth, a cavity, or sensitivity under a filling. Dentine hypersensitivity is incredibly common, and probably you will know at least one person who suffers from dentine hypersensitivity, and you will know that they won't be able to drink a hot cup of tea, or breathe in cold air, or drink a cold glass of water, or have ice cream, or even bite into an apple because of the sensitivity. As a result, they automatically avoid these kind of food or drinks, and they adapt somewhat. So, for example, if they like drinking tea, they will wait for the tea to cool down sufficiently until they can drink it without hurting their teeth. Probably about 40% of the population will or do suffer from sensitive teeth or dentine hypersensitivity, and there are quite a lot of differences in who gets it, their habits, their diet, and so on. Now, generally speaking, dentine hypersensitivity occurs when the underlying tooth called the dentine becomes exposed. However, not everybody who has exposed dentine around the neck of a tooth actually will get sensitivity. Studies show that it's around about 40-45% of people who do have exposed dentine that they will suffer from some sort of sensitivity. The age range can be quite wide, but you generally tend not to see it in children and teenagers, and in addition you tend not to see it in patients over the age of 50. As we will see later when we look at what causes dentine hypersensitivity, it will make sense why this age range is this age range for people who get sensitive teeth. So I would say that the common age range where most people will get dentine hypersensitivity is the ages of 30 to 40, and there will tend to be more female individuals who get sensitive teeth, and there will also be some relationship to how they clean their teeth and what their diet is like as well. About 10% of individuals who get sensitive teeth will say that the sensitivity has become a serious or a bad problem for them. So it might be so bad that they can't even breathe cold air when they go outside, or they might even touch the area which is sensitive with a toothbrush or even with their finger, and is very painful. So let's have a look to see how teeth do become sensitive. In order to understand how teeth get sensitive, we have to go back and look at the actual structure or anatomy of a tooth. So if you can imagine a back molar tooth with roots, the tooth has got a protective layer on the top So if you open your mouth and you see a big molar at the back, it will be covered with a material or a substance called enamel. This is like the white bit of the tooth. Enamel is the strongest substance in the body, and it does not have any nerves in it. You could take away a tiny bit of enamel from your tooth and not feel anything whatsoever, in the same way as a fingernail is dead and you can clip your fingernails and not feel anything. However, under the enamel is something called the dentine pulp complex. So let's see what this is. In the center of a tooth you have the nerve, which is also called the pulp. Now the nerve of a tooth has got millions of tiny nerve endings, so this is like the real sensitive part of a tooth. Anybody who has had toothache will know how sensitive the nerve of a tooth can become. Now, overlying the pulp is something called the dentine, and this is where the term dentine hypersensitivity comes from. The dentine is connected to the nerve of a tooth, so it's considered a vital tissue, and it can respond to touching and hot and cold and sweet things. So normally the dentine is covered by enamel on the surface of a tooth, so it's protected, and on the root surface of a tooth is protected by the overlying gum, and also by another material called cementum, which is in a thin layer on the surface of the root. Now, if you get some gum recession, you will expose the neck of the tooth. So here there's no gum to protect it, there'll be no enamel, and if the cementum has worn away, then you've got exposed dentine here, which is obviously sensitive and can detect sensitivity. The dental material itself has very tiny tubes running through it, and these tubes contain a fluid called dentinal fluid, and also the nerve endings from the pulp are also situated here as well. So this is how the dentine responds. The dentine actually responds when the fluid inside the tubes starts moving, and this is what really causes it. So whenever you have exposed dentinal tubes on the neck of a tooth and there's no other protection, this is where sensitivity occurs due to the fluid movement, and consequently the pain response as well. So treatments which are designed for sensitive teeth aim to put a layer on this exposed dentine surface, or they try to narrow the tubes down, or to cause a substance to precipitate inside the tubes. So dentine hypersensitivity or sensitive teeth is actually one of the conditions that most patients will know already before they even go to see the dentist. But a lot of people will still go to the dentist for the dentist to have a look at, and it'll be quite easy for the dentist to notice that that is indeed the problem. The problem will easily be noticed by a dentist because firstly he will notice that around the neckline, around the gum line of a tooth, there will be exposed dentine, and also you may blow air on that area or touch it with an instrument to see that that is indeed where the pain is coming from. Now, treatment is really based on treatments that the dentist can do in the surgery, but also what you can do at home, and this is the basis of our review of toothpastes that claim to treat sensitive teeth. As we discussed above, there are some individuals who are more at risk for dentine hypersensitivity, and these are those who are a bit too over enthusiastic with their brushing. So they might put too much pressure when brushing their teeth, or use an over abrasive toothpaste, or a really hard, tough, bristled toothbrush. This causes the gums to possibly recede and will cause the cementum or the enamel to start wearing away, hence exposing the dentine. The next group is those who have had gum disease. This is because during gum disease the gums can start receding, hence exposing the root of a tooth. Then we look at people who have a high acidic food and drink consumption. Again, this has an effect on opening those dentinal tubes up, so this will increase the sensitivity. There is also a link between those who chew tobacco and they tend to have more sensitive teeth or dentinal hypersensitivity. So the first thing a dentist can do is to recognize what perhaps may be aggravating the sensitivity, so the dentist can give advice on brushing, especially in relation to how you brush your teeth and the type of toothpastes. They can also examine the gums for any gum disease, and they can also give advice on carbonated sugary drinks, certain fruits like apples, lemon, oranges, even alcoholic drinks, just to highlight anything that that might be aggravating the sensitivity. So these toothpastes, let's see how they actually do work. If you look at the packet of a desensitizing toothpaste, you will notice that it will contain a potassium salt, such as potassium chloride, potassium citrate, or potassium nitrate. And what these potassium salts do is that they move along these dentinal tubes, and in doing so they block the action of the nerve fibers, and they decrease the sensitivity of the tooth. In addition, you will notice that these toothpastes also contain fluoride, such as sodium fluoride, and also calcium phosphates. Both sodium fluoride and calcium phosphates cause remineralization of the tooth surface. So as we said above, that once the enamel has been worn away, this is where the dentine can get exposed, and this is where remineralization of the enamel can help to reduce the sensitivity. Fairly recently, some of the toothpastes also contained this other ingredient by way of clinical studies. This ingredient is called arginine, and arginine works by establishing an alkaline environment, and this promotes the precipitation of more salivary calcium and phosphate on the surface and within the dentinal tubules. Furthermore, the calcium carbonate, through attracting arginine, forms a molecule which is positively charged. So arginine is another ingredient apart from the calcium salts and fluoride that you will notice. Dentists sometimes also have intervention treatments as well. So for example, they may use filling material called glass ionomer, which forms a barrier on the surface around the neck of a tooth, and this causes an improvement in the sensitivity. It's a bit like having a plaster put on the tooth. In addition, dentists will also use various solutions and adhesive gels to reduce the tooth sensitivity. They will also use materials which can precipitate crystals on the surface and inside the dental tubes to decrease the dentine permeability. Again, each dentist has their own particular varnish or adhesive resin that they prefer to use. Very finally, you may notice some dentists are starting to use lasers, and there has been some research where using a laser on an area of a tooth which is sensitive tends to reduce sensitivity. The reason why the laser works is by making the internal nerve inside the tube a bit less jumpy. It also can also occlude the tubules through partial submelting, and finally it can actually coagulate proteins of the fluid inside the dental tubules on the surface of the tube. However, not everybody is suitable for laser treatment, so this is something that you should discuss individually with your dentist. So now we've spoken about why you get sensitive teeth, who is more susceptible, what treatments the dentist can do. Let's have a look at the treatments in terms of toothpastes that you can do at home to reduce your teeth being so sensitive.